the most important aspect is the centering around the patients. They are the ones who have lived experiences. What is it that they would want us to improve on? Is it matters to do with finances? Is it matters to do with access in terms of transportation, in terms of accommodation, in terms of their families and their caregivers? So those are the things that we realized that were some of the limitations, cutting across treatment, diagnostics, and even survivorship. So all our projects, the 11 projects, are touching on each and every aspect in terms of the continuum of cancer care. So in Nairobi, for instance, we do have 2 national level facilities. That is Kenyatta National Hospital and Kenyatta University Teaching and Referral Hospitals. Those are the hospitals that have, in terms of public hospitals, those are the hospitals that have comprehensive cancer care. You can walk in, you'll have your diagnostics, you'll have your treatment, and you'll have complete treatment, so to speak, in those facilities. For our county facilities, it's still a work in progress because some of them are already doing diagnostic services. Others are able to refer to the bigger facilities. And so a bigger bulk of the treatment in Nairobi is actually done by the private facility. So we are asking, how can these private facilities come together with the public facilities? Because again, a majority of our stakeholders or our patients go to public facilities. So how can we integrate this and ensure that that common person is able to access a good level of care? It may not be at the same level, but that is what we mean by resource stratified, where at that level where they are, we ensure that they are still able to get quality care.
And so for us as a county, it's really just enabling us to do our role, to complete our mandate in partnership with the national government. As you've heard Betty say, a lot of the cancer care is given in the national facilities. However, county is now starting to take its place to actually just offload the national facilities from that cancer care, but also just expand the reach and access for not only our citizens who live in Nairobi, but Nairobi also caters for not only the national scope, but also the regional scope as well. So that's what is in it for Nairobi.
So the implementation we normally expect between 18 months and 28 months. Some projects will go very quickly, some others are more work intense, and also let's also be conscious that all this work is done by the workforce, by the people that are every day with the patients, both from nurses, from pathologists, from surgeons. So they're combining their daily work with this work, thinking of the greatest good for the people and not thinking on their own institution and their own interest. So it's actually quite, commandment to like the people, how the people in Nairobi and the government are all pushing on the same direction towards the benefit of the patient and not to their institution, because this is all extra hours that they're putting on this.
National or the entire country is that choosing Nairobi to be part of the work in the City Cancer Challenge is that we are going to learn what it means for improved cancer care systems in the county of Nairobi, and us as an institute, we are going to scale up the lessons that we are going to be learning from the Nairobi. So we are really excited in terms of even capacity building. And to add on to what Wakili has said, that we are trying to introduce basic cancer services in the counties. So we are trying to, we work on a referral system where we find that KNH and KUTRH are very, they get so many patients, and that has an implication to the type of care that they get. So
Yes, good afternoon. My name is Beatrice Okumu. I'm the city manager for Nairobi. I work with City Cancer Challenge. It's an initiative that is looking at improving access of cancer care across cities, and Nairobi is one of the cities that we have been working with. We have 15 other cities, and so today is a very memorable day for us because we have milestones that we want to celebrate. And Nairobi joined the city Cancer Network in 2022, and we have an MOU signed between the Nairobi County Government and the Ministry of Health to really ensure that we work together with all the stakeholders, both public and private, to access the gaps within the health system and to ensure that we work towards improving those areas that we were able to find gaps. So today, for instance, what we are coming to say is we did a needs assessment across 21 facilities, 112 healthcare workers, 20 civil society groups, 250 patients, to just understand where are the gaps when it comes to cancer care and what can we do as a system to improve that. And so today we are here to report that we have 11 projects that we want to work on, and these 11 projects cut across treatment, diagnostics, quality of care, and also projects to do with community and patient access. Other than the projects that we are launching today, we do have reports that we have also worked on, which we feel the city would be able to use for other things within the city. We have a report on digital health assessment. We have a report on the research ecosystem in the city. We have a report on the overall situational analysis report that is showing what happened before we came in terms of the cancer situation, and our recommendations now that we have done the needs assessment and looking at what we envision to do in Nairobi. And hopefully these reports can help us, do projects that are meaningful, number one, and two, we can have this project scaled to other cities. Right now we're only in Nairobi city, but we hope that the government can also come in to scale some of these projects to the other cities across the country.
From your reports, can you tell us the percentage which you found before you came in and after the last 2 years?
So what we know is that there's a high burden of cancer, not just in Nairobi. Of course, being an urban area, we do see many cases that are coming to Nairobi for treatment. But from our report, we were able to understand that there are gaps when it comes to treatment, gaps in terms of, early detection.